All right, well, Maria is with us now. Maria, we'll start with your own story and what happened on the bus 7 years ago.
Yes, that's right, that infamous bus. It was on Car-Free Day in the city. It's always the 22nd of September. I had walked to my destination. I was on the bus home, and next thing I know, I remember being on the bus. Next thing I remember is two strange men asking me to follow them, that I'd had an epileptic fit, and which made absolutely no sense to me because I'm not epileptic. But it transpired that they were paramedics asking me to get into an ambulance and go to the hospital with them. So a few weeks later, I was diagnosed with a brain tumour.
And that's what caused the seizure?
That's what caused the seizure, yes.
All right. Up to this point, you were fit and well and healthy generally?
Yes, I'm always very health conscious. I have a good diet, and I used to take a lot of exercise. I still do. So it was a surprise to me, very much so, to say the least. And I think also to my doctors, to the doctors who were looking at me, because they were surprised themselves because I was so fit and healthy.
What's it like being told you have a diagnosis of cancer? It's a brain tumour and it's cancer.
Yeah, initially it was just the brain tumour, and that was devastating. Complete shock.
Yeah.
I expected the worst when I heard it first. But I suppose after a while you get used to it, and you just remain positive and think of the positive outcomes that happen others, so that would happen to me as well.
I know a lot of people who've been diagnosed with cancer, they often say you're almost expected now to say, I'm going to beat this isn't going to beat me, and sometimes you feel like I'm too sick, I can't fight right now.
That's true. Well, initially when I was diagnosed with the brain tumour, they didn't know if it would be malignant, which means cancerous, or benign. So when it was only after the surgery that they confirmed that it was indeed malignant. So then suddenly I was a cancer patient, and that in itself was an adjustment. But yes, it's true. You know, you do have to be strong. Sometimes you lapse because it is tough, but you, as I say, you have to remain positive, and the treatment nowadays is excellent.
Okay,
and certainly it was for me.
So you went through all the conventional treatments. You had radiotherapy, chemotherapy, all of that. So what led you down the path then of acupuncture?
It was during the time I was being treated for chemotherapy and radiotherapy, and it was working on me. But I did have negative side effects, which I suppose they're a necessary evil, you could say. They're for the greater good. But I had nausea and headaches. Some days I was extremely tired, maybe I had no appetite. And a friend suggested that I try acupuncture, that it would work. So I went to an acupuncturist, and she also was a naturopath.
What does that mean? Into herbal supplements?
Yes,
that kind of
herbal supplements and nutrition.
Okay.
And the acupuncture she gave me really worked. I relieved the headaches and the nausea. I felt I had more energy, and also it was a nice place to be able to talk to her as well, because acupuncturists tend to be caring by nature. And
it's a relaxed environment. It's not sort of a busy GP setting, a waiting room or what have you.
That's true, yes. So it very much complemented the chemotherapy and radiotherapy that I was getting.
What did your doctors say, your conventional doctors, if you like, make of this? Did they discourage it? Did they say go ahead with it?
I checked with them if it would be all right if I had acupuncture, and they said that that it would be. Okay. So they were fine with that, and I wanted to be sure that they were okay with that too, because our health is the most important thing.
Sure. Now the skeptics would say, look, it's all in the head. You know, the mind is a very powerful organ. If you think it's working, it will work. You will feel better.
Well, it's true that the mind is a very important organ, and the body goes where the mind takes it. But there is a lot of evidence, or there is evidence to show that acupuncture does work. I think initially it worked on me, so I'm a believer. I'm now practicing acupuncture, as I mentioned, and my patients at Acuwell say the same. And you know, at the end of the day, if it works, it works. And I can say it does, and so do my patients.
Are there any alternative therapies, Maria, that you don't buy into? I mean, there's lots of them out there. We're going to be talking about some of them after the break. Any of them that you say, no, complete hocus pocus?
No, there aren't. I haven't tried them all. I've tried Reiki, and I found it very good. What else have I tried? I tried craniosacral therapy. I found that very good also.
What is craniosac therapy?
It's where there's an adjustment between the sacrum and the head. It's a very gentle movement of the bones and readjusts the balance. Okay. I found them good. I find osteopathy excellent also.
Okay. You're fit and well and healthy now, and you're practicing acupuncturist.
That's right.
For our viewers this evening who are saying, this is big business, there's lots of money, and for goodness sake, putting a needle somewhere in your body, how could that possibly work? What's your message?
Yes. Well, it does work. I suppose if you look at acupuncture is an ancient medicine, which originated in China over 2,000 years ago. And it has evolved over the years to be the standardized acupuncture practiced in China and in the Western world today. It views I suppose our bodies are seen as an energy system where chi or vital energy is flowing, and if there's any imbalance to the flow of chi, or if there isn't enough chi, or it's flowing the wrong direction, acupuncture can correct that.
And unblock the channels and,
yes,
and
exactly,
all the rest
and
of it.
adjust the balances.
Okay, well, I'll tell you what we're going to do is we're going to get into this whole debate after the break.